Now I would like to introduce our guest speaker, a patient of Dr. Chichua's. She will share her experience of living with lung cancer with us. She is a cancer survivor. Please welcome Bethanne Denker.
Hi, Janine has introduced me as a survivor. I am currently a thriving survivor, excuse me, thanks to the Perlmutter Center. Let me explain to you how I got to this point. I started smoking when I was 14 in the 60s when it was cool and a lot less expensive. In addition to a pack of Newports, I was also walking around what is now called the BRCA gene. For my 50th birthday in 2000, smack in the middle of menopause, I was diagnosed with breast cancer. Goodbye to the hormone patch, hello to a lumpectomy, followed by radiation and 5 years of tamoxifen. And I smoked right through that. For my 60th birthday, I was diagnosed with non-small cell lung cancer. There were no symptoms. I had gone to the doctor for a flu shot and saw a new nurse practitioner who was very thorough. She insisted on a full checkup before the flu shot. She asked if I smoked and when was my last chest x-ray done. I figured probably right before the lumpectomy. She wanted me to have a chest x-ray, and I said, sure, can I have my flu shot now? 2 weeks later, the nurse practitioner called me to let me know that she did not receive the results for my chest x-ray, probably because I never went. I was busted. I went for the x-ray, and a spot was seen on my lung. My daughter, who is a registered dental hygienist, spoke to 2 lung specialists who were her patients. They insisted that I see Dr. Chichua. We all know that Dr. Chichua is highly respected in his field. You should also know that Dr. Chichua is a loving and caring man, though he doesn't go for the mushy. He has a great sense of humor and always has a good and sometimes bad joke or story to tell you to put you at ease. He gets to know you. He listens to you. He looks at you. He holds your hand. He makes, excuse me, he makes every appointment into a visit. That first day, I also met Gary Shelton, who was Dr. Chichua's nurse practitioner at the time. Gary has since received his PhD and now directs the supportive oncology program at NYU. As Gary sat in on my first meeting, I could see the concern in his eyes. He was reassuring and ready to help. Gary has become a dear friend to me. He is part of my medication. His huge hugs are instant remedies. Through chemo, radiation, and my appointments, I found the rest of my NYU family. Melissa, Ileana, Natalie, and now David, and all nurse practitioners on Dr. Chichua's team. And Inessa, my wonderful chemo nurse, who apologizes when she has to give me a B12 shot. This team plays to win. Every person's story is different. How each person manages is the key. A wise friend told me, I can walk the road beside you, but I cannot walk in your shoes. She has remained with me on this road. You find out who really cares about you. I have lost some very good friends, and I have gained some very special new friends. I've had good days, and I've had bad days. I've had furniture moving, steroid highs, and I've had can't get out of bed low lows. I've had good hair days, bad hair days, no hair days, and some fake hair days. I have stopped smoking, gained weight, started exercising for the first time in my life, lost weight, and learned to live every day. A little advice to all. Don't waste time looking for side effects. Go on with your life and deal with the symptoms if they occur. I am now 65 years old, and there is no evidence of disease. NED, they call it. For my 70th birthday, I'm planning something a little less medical and more fun. Since 2012, I have been on Alimta maintenance every 3 weeks. During the years since the diagnosis, I have spent a lot of time at the Perlmutter Center. Every person that I've met is professional, caring, and supportive. The valets, the check-in people, the doctors, the nurses, the social workers, the ladies who clean the coffee machines, and those wonderful massage therapists. They all treat every patient as a person, not a disease. They make you feel special each time they see you. I often wonder if there's something pumped into these buildings. It is truly exceptional. November is Lung Cancer Awareness Month. Put on your white ribbons and your blue bracelets. There's a little confusion as to color, but that's not what matters. The message does. They're called giveaways. Instead, use them as takeaways to remind everyone to become aware of the causes, prevention, and early detection of cancer. We thank all the doctors who continue to do the research. I hope for a cure so no one else has to walk this road. But if you or anyone you know does have cancer, have it at the NYU Perlmutter Center. Thank you.